Detectives, innovators, counselors, advocates, and humanitarians, you're invited to meet the medical doctors of the OC Healthcare Agency.
Hi, my name is Dr. Christopher Ried, and I'm the Medical Director of HIV STD Services for the county healthcare agency, and I've been with the county for 16 years. My residency was in internal medicine, but the day after I finished my training, I immediately went to work in a nonprofit HIV clinic. So really, since many years, I've been only doing HIV and STD. I went into medicine because I loved science and because I wanted to help people. I mean, it's cliche, but I think a lot of doctors would tell you the same exact thing. About the time I was finishing my training, the AIDS epidemic was booming big time in the United States, California. And I was very interested at the time in infections and cancer, and I couldn't decide if I wanted to go into infectious disease or go into oncology. And HIV at the time was very much so both of those. I felt there was a need because there weren't a lot of physicians that wanted to treat patients with HIV, and I found it very, very interesting as well. My job is different, and our clinics are a little different than a lot of other county clinics. We really are doing personal health care for patients. In the STD clinic, treating their STDs, in HIV clinic, treating their HIV. But in treating them, you're actually helping the public health, because when you treat an STD and you counsel the patient, you prevent them from spreading it to other partners. And in the HIV clinic, medications nowadays can completely eliminate the virus from the blood and makes the patient not contagious. So we're treating them, saving their life, but at the same time, we're helping the public health in general. STD doesn't really change a lot. I mean, certainly the rates of STDs have gone up dramatically in the last 5 years. But in HIV, things are always moving, things are always changing, new medications are coming out. The disease is so treatable now. And there's a medication now that we've been using to treat HIV for many years that we're using now to prevent HIV infection in people that are at risk. And we've set up a PrEP clinic, which is pre-exposure prophylaxis. So before one gets exposed to HIV, you can take a medication every day, and it works very, very well to prevent contracting it. For PrEP medication to prevent HIV, if you take it every day regularly, it's probably in the high 90s in effectiveness. So really everyone that comes into the STD clinic right now is evaluated for PrEP if they're at risk for HIV. And the clinic is growing and growing and growing day by day. I think it's going to be highly effective in the community to lower our HIV infection rates.